Good afternoon everyone. I am Dr. Bhattacharya from Dental Cure, Mira Road East, and I am a periodontist, and today I will be explaining you the requirement of crowns or caps in pediatric dentistry. So basically, when you see a child, a very beautiful smile, a laughing child is the best image that you can ever see, a smiling child come over to you. But gone are the days where the kids used to have all those blackish discoloration on the tooth, and parents used to think, yeah, it's just a milk tooth, let it be. But nowadays parents are more and more concerned about the aesthetic part, about the looks of the child, because these things affect the self-confidence of a child, and it also brings in the upliftment of the child in a much better way in the school environment as well as in the home environment. Now the next question that comes into mind is why the caps are required. Now usually the first or the chief complaint the parents come with their child is दांत काले दिख रहे, like there is a blackish discoloration on the tooth. क्या कर सकते? What can be done? So we advise them to go for a filling, for a root canal. Now these extensive treatment where we use an instrument or a burr or a machine to grind those or remove those cavities, the tooth structure becomes weak, especially when we do a root canal or a pulpectomy in a kid's mouth. Now to prevent that breaking of the tooth, now if you don't just place a cement after doing a root canal, it will fracture, the tooth will come out. So to prevent that, or to help the child in eating properly, in chewing the food properly, we place a cap. Now there is one reason why we place a cap after doing a root canal therapy. Now there are certain other conditions where just cavity is there, but the cavity is deep. It requires a lot of filling, it requires a lot of tooth structure to be trimmed. Now in that case, if we place only a cement, it will come out or it will fracture. In that case also we require placing a cap. And specifically when the teeth are in the front teeth are all decayed, obviously in that we cannot just place a cement because it's going to come out, because there is no attachment, there is no retention part for the cement to stay. In that case also we place a crown. As you are now aware of one of the conditions where we place a cap, now I'll explain you what are the types of caps that are available and how these caps are different than adults cap. So basically I'll come to first what is the difference between a cap which is placed in a child and what is the difference between a cap which is placed in adults. So basically, as you are aware of, after placing a root canal, most of the dentists will suggest you to place a cap for the reason which I have stated, that the tooth structure will fracture or to prevent the cement to come out. Now in adults what happens is there is a lot of techniques which is not usually done in kids, like for example the taking of the impression. In adults we usually take the impression, so that we send the impression to the lab guy, and the lab guy prepares the cap in adults, which is then fitted in the final appointment time. In kids there is no lab work. Basically the crowns that we fit in a child are all preformed, that is वो बना बनाया रहता है. It is not manufactured by any lab guy, it is already made by the company, and all pediatric dentists or those dentists who are practicing pediatric dentistry in their clinic have those cap already preformed. So there are different sizes are there, whichever size fits it puts in. So the main advantage of dealing with kids is the impression, putting that impression in a child's mouth is prevented, so it prevents the child from vomiting or having a gag reflex when we place an impression material. Secondly is, since the caps are preformed, it is much easier for the cutting procedure, so less time consuming, less less cutting of the tooth structures required in the kid's mouth. Hence it is much more comfortable in kids compared to adults, where we place a cap when doing the placement of the cap. So these are certain differences that are there between an adult cap as well as in a child's cap. Now coming to the different types of caps that are available in a kids. Now when it comes to the front teeth, there are two types of caps are there. One is a strip crown, we call that as strip crowns, and the second one is a zirconia cap. Strip crowns are basically, they are thin transparent type of plastic type of crowns are there, which we fill it up with cement and place it on the tooth structure, and we strip or we remove that structure so that a coating of the cement stays on the tooth structure. But the main disadvantage of this cap, of this type of strip caps, is the cement, the retention part or the strength of the cement or the cap is very weak. So there is a possibility that whenever the child eats something or bites something from the front teeth, it may fracture. So now what has happened, as the dentistry has evolved, we have come up with the zirconia crown. Now zirconia crowns are basically white in color, it's completely white, there is no metal structure in that cap given, and that is more sturdier, and in strength wise is more has high strength compared to a strip crown. So nowadays zirconia caps are the most preferred crowns when we are placing on the front teeth. Yes, on the back side also we can place caps of zirconia as per the requirement for the parents based on the aesthetic part. So the next cap which we come into is the metal cap. Metal cap has been practiced or used in pediatric dentistry for a very long time. It is the most sought out cap which all doctors or all pediatric dentists use. Usually it's all, obviously it's a metal in color, it does not aesthetic purpose, so it is usually used for restoration for the back teeth. So the advantage of metal caps over zirconia is the tooth structure. The cutting of the tooth structure is less compared to zirconia crown, but yes, it cannot be used for the front teeth for obvious aesthetic reason, so we generally use it for the back teeth. Now the next question that most of the parents ask me is, ये cap गिरेगा कैसे? How will the cap fall off? So basically what happens when the milk tooth falls, or when the milk tooth starts to rock, it falls off with the tooth structure. So you don't need to worry that the tooth that it will be locked inside the mouth and the new teeth will come in a crooked manner. No, that's not the reason. So basically when the tooth falls off, it will fall off with the cap. So this is a basic outline or information that I would like to suggest regarding pediatric crowns. So basically in a nutshell, what I would like to say is, when you're doing a root canal or a pulpectomy in a child's tooth, caps are important. Whether you place a metal cap or a zirconia cap, that's up to the choice of yours as well as the pediatric dentist who is performing the procedure based on the structure of the tooth. But cap is definitely should be placed after doing any major root canal or pulpectomy procedure. There are certain other areas where, suppose in a class 2 cavity, meaning the cavity is in between the tooth structure, where there is no natural retention for the cement to place, there you need to place a cap so that it will prevent the fracture of the cement which is placed on the edge of the tooth structure. And in cases where the cavity is deep, the filling requires there's a lot of filling is required, in those structures I would suggest placing a cap should be advisable. Thank you so much for watching this video, and if you want to know any more information regarding crowns in pediatric dentistry or anything regarding pediatric dentistry, please let me know in the comment section. Thank you.